the second Sisonke trial is up and running, and health workers will start getting their COVID-19 vaccine booster shots today. It was delayed yesterday due to a technical glitch. Almost 500,000 people were vaccinated as part of the study, which opened the country's inoculation program. We'll get you more on this. We're joined by the Department of Health's COVID-19 team leader, Dr. Lesley Bamford. Dr. Bamford, thank you very much for your time this morning. I know it is a busy day for you, so perhaps let's start with how proceedings have fared this morning at least.
Well, good morning and good morning to the viewers. So unfortunately, although Sisonke will start today, there have been some further delays. We've been experiencing some technical glitches just in setting up the system that is required, whereby healthcare workers are able to consent to be part of the study. We have been assured that the SMSs, which will kickstart this process, will start going out later this afternoon. So our sites are all up and ready and rearing to start vaccinating healthcare workers, and we are hopeful that we will be able to start vaccinating at scale during the course of tomorrow.
So is my understanding correct that no health worker has been vaccinated as yet because of these technical glitches today?
So that is correct. There are a very small number of healthcare workers who will be vaccinated at one of our sites, but the full program, as I indicated, the way that this will start is that all participants from the Sisonke 1 trial, everyone who participated in that trial, will be sent an SMS with a link that allows them to consent to be part of the trial. So remember that because this is a trial, everyone who's vaccinated needs to consent to be vaccinated. But when this is done as part of our vaccine rollout, this is a simpler procedure that happens as part of the vaccination process. Because we are doing the Sisonke booster study as an implementation study, the consent process is a little bit different. It's a little bit more complicated. We had hoped to have our systems up and running, but like many things in the country, they have been delayed by load shedding. So we are anticipating, as I say, that those SMSs will go out later today. People can consent, and the sites should be able to start tomorrow.
Just a reminder, perhaps, Dr. Bamford, what it is that you are looking for with this study.
So with the Sisonke 1 study, healthcare workers were offered early access to the J&J vaccine. Now, we know that vaccine provides excellent protection against COVID infection, particularly severe COVID infection, for a period of 6 to 8 months. However, as I'm sure you are aware, our first healthcare workers were vaccinated in February, so they are reaching that 8-month period where there is evidence that the protection may be waning. So we will be currently offering a booster dose of J&J and looking to understand what additional protection that booster dose provides to our healthcare workers. And this is important information because further along the line we will have to make decisions about providing booster doses more widely to the general population. So for now we are confining it to Sisonke participants and hoping to learn and understand more about the effect of booster doses.
We understand that almost 500,000 people were vaccinated as part of the study, right, as you rightfully mentioned, which kicked off in February. Are you perhaps to give us an assessment of the number of healthcare workers that have taken up to getting vaccinated and those who are still hesitant, and what needs to be done there?
So as you correctly say, 500,000, just less than 500,000 healthcare workers were vaccinated through the Sisonke program. But additional healthcare workers were also vaccinated then as part of the vaccine rollout, which started in the middle of May. We do not have the exact numbers, and we know that there are some healthcare workers who have not yet vaccinated. So that said, we do know that the majority of healthcare workers, particularly our frontline healthcare workers, have vaccinated and are protected. Those who vaccinated under Sisonke will be immediately offered the booster dose of J&J as part of Sisonke 2. And then we are also looking at providing booster doses to other healthcare workers who were vaccinated as part of the vaccine rollout.
Right. My colleague Michelle Craig was in conversation about this a little bit earlier on, and her guest pointed out that South Africa is following the lead of countries in the north that have done this in terms of giving booster shots to their healthcare workers. While I do appreciate that this is new for all of us, right, why was it important to follow their lead?
Well, I think we look at a variety of factors. We look at the evidence from clinical trials. We obviously look what's being done in other countries. We have not yet made a firm decision about providing booster doses to the general population, but we were convinced that we need to protect our healthcare workers, really for two reasons. The first that we've already mentioned, that our healthcare workers were the first to be vaccinated. So those who vaccinated early in February and March have now reached that point, that it's more than 8 months since they were vaccinated. The second reason is that we know that our healthcare workers are particularly high risk due to their the work that they do. And we felt that it was very important that we provide them with additional protection before we enter the anticipated fourth wave.
Thank you very much to Dr. Lesley Bamford, Chief Director for Child Health Program and COVID-19 Team Leader at the Department of Health.